Good day, everyone. My name is Mary Claire E. Rubio, a public school teacher of Calango Elementary School and a primary breadwinner in our family. Teaching has always been a passion to me. It is a calling to serve and to inspire young minds in the small community of Calango Elementary School. Like many other public schools here in the Philippines, I lived in a modest salary that is enough to meet the daily needs of my family, but it is very far in meeting the medical expenses that we are facing right now. Last December 2025, my husband and I received one of the greatest blessings in our lives, in that we are expecting twins. However, those dreams were interrupted on the very first day of school last June 8, 2026. My water unexpectedly broke and I was immediately rushed to Ace Dumaguete's Doctors Incorporated, where I underwent a normal spontaneous delivery, but due to complications, I was also delivering the other twin through a major operation through a emergency cesarean section. Our precious babies entered the world too soon. They are really small, and at only 29 weeks, their lungs, their heart, and some of their internal organs are not really fully developed. That's why instead of bringing them home, they are being transferred to the neonatal intensive care unit, where they continue to fight every breath and every heartbeat. Seeing our tiny children surrounded by incubators, tubes, and life support equipment is a pain that no words can express. Every day we pray for their strength. We celebrate the smallest improvement. Life in the NICU is a roller coaster ride. Sometimes we receive good news, but sometimes we receive a bad news. Like their DSATs are fluctuating, like we need to find their blood, their platelet to be transfused in their tiny bodies, and it's really hard as a mother. It has now been a month since they were confined in the NICU, and as they continue to receive specialized medical care, their hospital expenses continue to grow. The hospital's billing officer also reminded us and advised us that in these kind of cases where premature babies are in the NICU, we need to approximately prepare 2 million pesos to cover and continue their hospitalization, their intensive medical care, the medications, the procedure, and the professional fees. Hearing this estimate left us overwhelmed and heartbroken. And as an ordinary public school teacher, I honestly do not have the financial means to raise such an enormous amount despite all our efforts and sacrifices. As a mother, I dream the day that I can finally hold them without the barriers, without the equipments, be healthy and strong. Yet it is very heartbreaking to know that their chance to continue receiving the care they need depends on the resources far beyond our family can afford. I respectfully ask for any financial assistance you may be able to extend to help continue our twins' medical treatment. No amount is too small. Every peso you share brings our children closer to recovery and gives them another chance to continue fighting for their lives. The depths of my heart, thank you for taking time to listen to our story. Your generosity will not only help pay our twins' medical expenses, but you are giving them the opportunity to live, to grow, and someday experience the childhood every parent dreams of for their children. Thank you for becoming part of their journey toward healing.